Today is our inaugural Lessons for Lives Lost conference. We are hoping to be able to continue this as a theme, and the main focus is how we share and expand on learning from serious incidents, but particularly deaths in custody.
So myself and Annie Dale, our head of nursing, organised this conference to shed light and help develop the practice of following deaths in custody, and to support the staff who have gone through repeated traumas. They're seeing the same thing over and over again, and it's working in prisons can be very traumatic, and we see a lot of retention issues, a lot of staff who really struggle with it.
There's a lot we can develop. There's a lot more learning that we can share generally, and I think this is a really good way to start doing that, to start the conversations, to make it all just part of people's psyche and awareness.
This is partly aimed to help identify the support that's available and to provide the information that they need to help develop their practice and develop everything death in custody related. When a death in custody happens, it can be extremely anxiety provoking, making sure everyone gets done what they need to get done. So hopefully this conference will help with that.
We've had such expert speakers, and everybody has brought a slightly different perspective to it, from the coroner to one of the barristers to our own staff. So it's really helped, and everybody has put, I think, the families of the individuals at the sort of centre of it, which I think is really, really important.
Today was about introducing our new models of reflection and our new models of creating a framework that pulls everything together whilst we're trying to adopt and improve our learning from incidents, particularly deaths in custody.
So DETRACTS Plus is being launched today as a new framework. A lot of work from Annie and Emily Dell, who have developed this, and everything that we do patient safety wise is going to be focused around DETRACTS Plus and used as guidance for staff.
This will be the first of many conferences of this kind. It is so important that we continue to learn lessons and that we change our practice as a result of the lessons that we are learning. And I think the DETRACTS Plus model is a really sort of nice and neat way of capturing everything that we all need to do in our day-to-day working lives.
It's absolutely inspiring. Lessons from Lives Lost is so important. The quality of the speakers, the reflection, the thematic reviews, the DETRACTS Plus, it's amazing. Real credit to the hard work that's gone into this. Well done, everybody. I'd really like to see the next steps coming out of this. I'd really like to see how far we can take the learning from the themes. And I'm looking forward to family involvement in the future. And I'm really pleased that there's some family members here today.
I think it's been brilliant to hear from all of different speakers and have a look at what sort of things we can learn across different agencies, not just within healthcare. I think for me, as the continuous improvement lead, it's going to be brilliant to take these lessons back over to the southeast as well, and see what we can do in having a look at continuing these reflections back over there as well.
So I've come here today to talk mainly about preparation for inquests. All deaths in custody are subject to a coroner's inquest. As a member of the healthcare team working in a prison, unfortunately over time there is a great chance that you'll get called to inquest and be asked to give your oral evidence in doing so, and that's a very stressful, worrying time for people as they're trying to understand what their part was to play in that, and my talk today is really about preparation for that process. So how can you best present yourself, your involvement in that patient care to that inquisitorial process.
I'm really keen that we make sure that support and guidance and advice is available for people post-incident, but also with colleagues from the rest of the prison as a team approach to support and guidance and after the event, because I find sometimes people can work in silos and we don't need that. We need to be working together.
With the support we provide staff, we've got the care team, which is a confidential support service available to anybody who works within the prison, anybody who attends there, and it's supported by volunteers, peer-led service. It is staffed purely by prison staff at the moment, but we know the environment. When things happen there, we've generally experienced that, so we know the impact it can have, and it is the opportunity for people to talk. Because like I said, working in silos, working in silence, we don't know what the person next to us is going through in life. One incident could be the breaking point, but what we give them is the opportunity to be able to talk, and actually talking really helps. It's one of the biggest tools that you can do to help work through these incidents, to help move forward.
We have to fit our own masks before we can look after anyone else. It's not, looking after yourself is not selfish. It is so important that we look after ourselves before we look after other people, so we can do the best job we can. And I really feel that reflecting on practice and actually sharing the learning and improvements with other people is so important, not just in healthcare, but across the whole of the team who are caring for the same people.